Good afternoon. I'll call to order this meeting of our Housing Policy and Development Committee. I'm Chair of the committee, Councilmember Cam Gordon, and I'm joined today by Council Members Ellison, Bender, and Reich. We're a quorum of the committee, so we can do the committee's business. Today we have a public hearing, 2 consent items, and 1 discussion item. I think I'd like to take the consent items first, because I think we can dispose of them relatively quickly. I'd also like to call my colleagues' attention to 1 item that I'm adding a staff direction to, or I will move to add the following staff direction to item number 2, which is the conduct unlicensed premises ordinance referral to staff. This would direct staff to create an internal conduct on premise work group to consist of representatives from the police department, regulatory services, the city attorney's office, and the health department, and to report back to the Housing Policy and Development Committee by September 30th, 2018. And this is something I talked to the lead author on about, and he's asking to do this as well. That's Councilmember Cunningham. The other consent item is appointment of the Director of Community Planning and Economic Development. Actually, don't get too excited. We're not going to be approving the appointment. We're just going to set the public hearing for that, which we'll be considering it at hearing of March 27th, 2018. And this is going to be a committee meeting that we're holding jointly with Zoning and Planning Committee and Economic Development Committee. Are there any questions on either of those rather complicated consent items? I must have explained them well enough. Thank you very much. I'll then call for a vote. All those in favor, please say aye. Aye. Any opposed, say no. Any abstentions? Those motions carry. Then we can move into our first item, which is a public hearing, and we'll have a little report before the public hearing. This is on the Riverton Community Housing Bond issuance, and I believe we'll have Ms. Holmes. Okay, we can do a presentation for us, and then we'll open the public hearing. In addition to the public hearing, we're also going to be approving some housing goals, which are on the agenda. Welcome.
Thank you. Good afternoon, Mr. Chair and members of the committee. My name is Shalonda Holmes, and I'm a Senior Project Coordinator in Residential Finance. I am before you today recommending the committee authorize final approval for the issuance of tax-exempt 501c3 housing revenue bonds in a principal amount not to exceed $25 million for the Riverton Community Project at 1220 Brook Avenue Southeast. Riverton is a nonprofit that operates and develops student-centered co-op housing and has done so since 1973. Riverton currently operates approximately 490 housing units in cooperative residential communities. The issuance of the tax-exempt revenue bonds will finance a new construction building that includes 95 units, ranging from studios to 3-bedroom units. Staff is also recommending this project be considered under the residential ownership portion of the Unified Housing Policy for the reasons listed in the staff report. The residential ownership policy is 10% of the units be affordable to incomes at 80% of the area median income. We are further recommending that this project be held to specific housing goals to maintain 50% of the units be affordable to incomes at 50% of the area median income and 75% of the units at 80% area median income for the duration of the bonds. This recommendation helps maintain a deeper affordability level within the project. There were no public comments received within the 45-day public review period, and Riverton staff and representatives are here today, and we're open to any questions if there are any.
I have a little question maybe. Could you just explain to us why we're having a public hearing? This is required because of the bonds?
Correct.
Okay. I appreciate that. Thank you very much. I see no other questions, and I will ask if there's, I'll open the public hearing and ask if there's anybody here to speak on this matter. Anybody who'd like to say anything additionally? Seeing nobody then, I'll close the public hearing, and I'm happy to move this forward and also the housing goals. This is in the second ward, and it's a project that I've been very involved in. I just kind of want to call it to our attention. It's very unique. Riverton is a housing cooperative. It's also unique because of the site where this is located. This is at the site of an old grain elevator by Van Cleef Park. I'm sure a lot of you, if you've, I don't know, driven down 35W or something, you've probably seen the White Tower. It has Bungie written on it in letters. There's actually, it's been a kind of a nuisance and actually a tragic property in the past. Two people have passed away there, maybe actually one during the original construction, but just since it's been vacant, there have been two accidents, kind of urban explorer type accidents, and two fatalities there, and we've been pushing for redevelopment. Project for Pride and Living has bought the property and has been trying to maintain security, and it's taken us a long time. So when Riverton came in as a partner after a very successful development, they've got a couple. They have two in Dinkytown, a very large cooperative that's been up there since I think the 70s, 80s, and then a newer one that they built. So they came in as a partner. And this will be a unique ownership model because it's a co-op. So all the residents there will be members of the co-op and they'll have an ownership stake in the building. And we found when there's cooperatives that are involved in buildings, those people are concerned with saving money, as you might imagine, for protecting their investment, making the improvements as needed, but also holding their operating costs down so that the rents are lower. And what they pay into it is lower at a monthly rate. So I'm excited about this. I'm excited that they have affordability goals that I think they're very confident that they can also meet. And then later, there's another development that's coming up on the other side. So they're removing all the grain silo storage, but they're preserving what they call the head house. So that landmark will exist, and that was one of the things the neighbors kept asking for. Can we have some kind of a development that could save some of the history? And I think they're going to be able to accomplish that too. So with that, I guess, seeing no other questions, then I'm going to move approval of this resolution authorizing the issuance, approval of the issuance tax exempt bonds, as well as the specific housing goals for this project. All those in favor, please say aye.
Aye.
Opposed, say no. Any abstentions? Those motions carry then. And that will bring us to our final item, a long anticipated report from the Public Health Advisory Committee. And this has to do with the creation of a housing advisory committee for the city.
Thank you, Chair Gordon and members
Welcome.
of the committee. Hi, my name is Sarah Jane Caveney, and I sit on the Public Health Advisory Committee. I represent Ward 9, and this is my cohort here, Margaret Peggy Reinhardt. She represents Ward 10 on the Public Health Advisory Committee.
Welcome. It's glad to have you here.
Thanks.
Thank you.
And Margaret, you've served on the committee for a while now, is that right?
Yes, this is your 6, year 5. Yeah.
Okay, wonderful.
Yeah.
And you're co-chairs?
We are.
Correct.
And we're happy to be here also just to acknowledge the creation of this committee to council and the intention that council has made around housing. That's really appreciated from our committee. We're happy to be at one of the first meetings and appreciate the focus and dedication of housing that council is taking to address the areas of social determinants of health and equity within our city. We're also happy to be representing the work and attention of our particular committee and colleagues from the PHAC, as similarly we propose this new Housing Advisory Committee. The Public Health Advisory Committee has named housing as a top priority for the past 3 years. In centering housing availability and affordability, we've included presentations and discussions with city departments, the University of Minnesota Institute for Metropolitan Opportunity, the Office to End Homelessness, St. Stephen's Human Services Street Outreach, and the 2040 Comprehensive Plan, the Health Research Liaison. There's a connection within each of these perspectives that housing will be primary area in which social determinants of health will be influenced throughout Minneapolis in the coming years. We are excited to be proposing an avenue that aims to achieve consistent input from residents and communities that are most affected by social determinants of health. Stable, quality, affordable housing impacts every outcome we can measure in assessing quality of life: health, education, employment, community participation, lower rates of involvement in criminal justice systems, and more appropriate engagement with social service sectors. With this increased attention and dedication that housing holds in our community currently, and it's a named issue, we will continue to take that connectivity and intention to develop ways in which our residents have ongoing input to positively affect health outcomes for future generations.
Yes, I am Peggy Reinhardt. I'm retired, and I have a background in public health nutrition, and I am the Ward 10 representative to the Public Health Advisory Committee and currently serving as co-chair. Our committee prioritized housing as a public health concern over 3 years ago, long before the apartment building boom in Uptown, Downtown, East Town, and along University Avenue, especially near the University of Minnesota. Members of our committee are not housing experts, but we know the relationship between housing and health. 4 distinct ways were articulated by the Pew Research Center. Housing quality, asthma, cancer, lead poisoning, cardiovascular disease, and poor mental health are associated with poor quality housing. Second, affordability, cost-burdened households, and I hope that you've seen the excellent material prepared by the Research and Evaluation of the Health Department, shows the neighborhoods where there are many cost-burdened households. They don't have enough money for healthy foods or medical care and expenses. They have higher incidences of malnutrition, diabetes, anxiety, and depression. The third relationship between housing and health is stability. Close and supportive relationships among neighbors can improve physical and mental health, reduce stress, and reduce exposure to violence and crime. And the fourth is location of housing. Access to public transportation, parks, jobs, healthy foods, and medical care can reduce the incidence of chronic disease, injury, respiratory disease, and poor mental health. The PHAC identified a gap in the housing development process: the lack of continuous and meaningful input from resident representatives across our city. This omission occurs during early stages in the planning and development of residential and affordable housing projects. Our committee thoughtfully put together the proposal for a Citizens Advisory Committee on housing based on our learnings from the wide variety of experts, from presentations and committee member experiences. For example, Community Planning and Economic Development Office reported to us, of course, Minneapolis is growing more people in the same geographic boundaries. There are sustained racial disparities in all aspects of housing. There are 10,000 fewer affordable units now than in 2000. And renter households are increasing faster than owner households. And of course, a tightening rental market reduces affordability and limited fair housing choices. The PHAC is supportive of our city's continuing efforts to ensure that housing is available and affordable to all residents as a way of ensuring a healthy, dynamic city. There is great connectivity now to do something, to do it well, and to do it today. For myself, I'm particularly concerned about housing for 2 population groups. The first is children. An estimated 2,500 Minneapolis public school students are homeless and highly mobile. I've tutored kindergarten through 1st grade at Lyndale, Jefferson, and Whittier schools. I see the negative health impacts of high mobility and homelessness on children: inattentiveness, anxiety, anger, difficulty adjusting to new schools and friends. This chronic lack of stable housing is an adverse childhood event that can have consequences for those. The second population is senior citizens like myself. To me, the choices are slim for affordable housing for baby boomers who want to remain in our neighborhoods in our city, but without the maintenance and expense of a home, and of course, at that point, have fixed incomes. Affordable housing is a multi-generational need. Our city has the wherewithal to identify future housing needs, and a Citizens Advisory Committee on Housing would complement that research and planning.
I have the good fortune of working a good deal of my career with people who are experiencing homelessness, residents who lack residence in our community. I got to review a little bit of this idea with them last night, and I'll let you know they weren't necessarily convinced that creating an advisory committee to council was going to be the heavy lift to make a whole bunch of affordable housing that's going to move them from homelessness into housing. They were, however, excited to hear that really the mission of this, or the spirit of it, is to make sure that residents who, like themselves, have experienced homelessness, who have been displaced from housing, or that are the most impacted by social determinants of health, are really centered within this proposal, so that those are the voices that are being elevated. A housing advisory committee provides a consistent, reliable source of continuous and meaningful input from the people of Minneapolis. The housing advisory proposal provides not only cross-sector, cross-department, and ward representation, it calls out the need for elevating the resident voice and the lived experiences of Minneapolis residents most affected by the current housing practices. It provides each council member and mayor the opportunity to appoint a person from their ward or the city according to the following criteria: persons experiencing homelessness in the last 5 years, residential tenants, landlords with rental housing licenses in the city of Minneapolis with no regulatory action taken against the rental license in the past 2 years, and housing advocates, including those who represent community organizations or faith communities most impacted by affordable housing. The proposal names representation of 6 members from local Adult Shelter Collaborative, Hennepin County, Minneapolis Public Schools, Minneapolis Public Housing Authority, housing funders and developers, and multifamily housing association or other trade groups representing landlords. It also charges the Housing Policy and Development Committee with the responsibility of committee composition and oversight, specifically assuring the committee membership is representative of communities most impacted by the lack of affordable housing in the city and communities most impacted by persistent disparities. This may be the most radical idea in the proposal, but holds this council committee accountable to ensuring that the resident voice is the predominant voice at the table and is composed of persons experiencing homelessness, tenant renters, no more than 5 landlords, and members at large who reflect racial, ethnic, and economic diversity of the people of Minneapolis.
Housing and development is an economic issue, a public health issue, environmental issue, social and racial justice issue, and more. The time is right for meaningful, continuous engagement and cross-sector solutions to the housing crisis, because housing is a multi-generational need and affects every outcome we can measure. Tenants must be able to inform policy changes to improve and protect their homes. Quality, healthy, affordable housing must be a top priority for policymakers, and the public, private, and nonprofit sectors must collaborate to ensure dignified homes for all. Creating a new housing advisory committee will bring all of these perspectives into the discussion, provide a formal mechanism for resident input and recommendations on housing policy and development, and together to create solutions with a common goal of solving the housing crisis for all of the people of Minneapolis. So thank you for your time and attention to this critical issue. Our presentation is concluded. We stand for questions.
I don't see any questions right now, but I guess I'll ask one. When I was looking at the various criteria, and this is something that I heard too, and we have residential tenants, persons that experience homelessness in the last 5 years, and landlords. But I noticed that nothing expressly says somebody who's just a person that owns their house.
So I think that there will be representatives of home ownership. Really what it's saying is that there have to be a certain representation for folks experiencing homelessness, for resident tenants. So the numbers will allow for people who own homes as well as have other interests.
I
Thank you for the
appreciate that.
question.
And there are other spots
Chair
there,
Gordon.
and there are presumably some of the advocates from some areas might live in if they're resident and own their home too. But
Yep.
I found that a little bit interesting.
I think
and
the
somebody
number
asked about
offhand was 23 individuals would be on there. So the numbers that are specific are making sure that there are, I think it's three individuals who have experienced homelessness in the last 5 years, 5 resident tenants, and then no more than 5 individual landlords. So within that 23 or 20 people, there will be some other room. We wouldn't cap it at that, I guess, as well.
Well, I also just want to say I really appreciate all the work that you put into this and also all the supporting information. There's some of the data there that I'm probably going to print and save just so I have it handy. So the health department must have done a lot of supportive work, I think, to bring you and whoever looked up Encompass and the community surveys to give us the map that you talked about and also the neighborhood by neighborhood idea. I think as we're looking at this, we're going to be coming up with ideas to put on a dashboard or metrics or something that we can measure. And cost burden households has come up a lot, and it was interesting that you featured that. So this is really valuable, and also all the specific information that you collected. And I know that I was even consulted on some of these ideas. I met with my representative on the Public Health Advisory Board. My plan now is to take this gracefully with great respect and gratitude and hand it over to our staff from the Housing Policy Development Division and Regulatory Services with Health Department input, and to work on it. In order for us to create one of these advisory committees, we need to create a resolution. So we also are going to look at what's required and stipulates, and the clerk's got some very specific guidance about what goes in a resolution to create one of these. So we're going to work on that and do it. And I suspect it will be tweaked and potentially changed a little, but you've given us, I mean, maybe not, but we'll see. So we're going to see what the staff says. I'm also very curious about input from colleagues between now and in the next 2 cycles or so when we come back, if there's ideas or suggestions or any concerns that you have. Sometimes council members can have specific concerns about the appointing authority. I appreciate that you did a ward by ward. I think that's interesting. We've got some groups that really work well that way. We have others that don't. I'm suspecting that might stay through, but we'll see. And I think there is a comment from Council President Bender.
Thank you, Mr. Chair. I just wanted to thank you also for your work. I think that Councilmember Gordon and I first met with members of the Public Health Advisory Committee about housing and the idea of creating an avenue for yourselves and other folks in Minneapolis to get more involved in shaping the discussion on housing maybe 3 or 4 years ago even. And so I know this has been something your committee has been working on, and I really appreciate the fact how you, at the beginning of your presentation, grounded us in the ways that housing instability is showing up in people's health. And for us to remember that even though we have our departments and our business lines in our city, that the issues are much more complex than that, and they really affect all these different areas. And we see that firsthand in my ward, as Peggy knows, with the increasing housing instability that we see, especially in the young populations in our schools. So I'm excited that we are at the point of being ready to propose a housing advisory committee. I think it will help shape the work going forward and help us prioritize our staff time. I think it will help us do a better job on something that Councilmember Ellison and I have been talking about, which is communicating in plain language all of the work that is happening at the city already in helping to try to increase housing affordability and stability. We started looking through our web resources, and it just isn't reflective of all of the work that's happening. So we're working with staff and communications and of course the housing staff and others to just even list out all of the initiatives that are happening, all of the different funding that the city's providing, the ways that we're working to try to preserve housing, and then also the things that are underway to try to make improvement. So your help in all of that is really appreciated and I think needed. And thanks, Mr. Chair, for moving us forward and asking staff to bring back a recommendation. It might not be exactly the configuration that you're suggesting, but I really also appreciate the intention behind what you're suggesting. And I think you're right that focusing particularly on those who are most vulnerable and who most need change in our city is right. I also know we have a lot of landlords in our city who are open-minded about how they can help support housing stability. I have landlords who think of their tenants almost as family, especially the smaller landlords. I have folks who've have a real social justice lens to how they're thinking about their own building ownership. And we need to capture those voices too and have them help us understand how we can support all kinds of creative strategies. I think we need much bigger thinking right now. So anyway, long way to say thank you.
Thank you very much. Those are
you.
very, very
Thank
good points. Yeah, thank you. I also wanted to just mention that I think there's other committees around the city advisory bodies that have brought up housing as really key and critical. We talk about it at the Youth Coordinating Board. I also was meeting with the Minneapolis Advisory Committee on Aging, and it's a major issue for them. They mention it in their strategic planning. They were very excited when they heard that we might create a housing committee. So I think they might be a little jealous because I noticed that you had two possible representatives, one from the Public Health Advisory Committee and one from the Disability Advisory Committee who could sit on there. And so we may have to think about where, non-voting, I understand. So that. I'll just share the staff direction that everybody should have in front of them, I think, unless I didn't get it all the way to Councilmember Goodman, who's joined us. Welcome. Glad to have you here. This is directing CPED, Regulatory Services, and Health Department staff to return to the Housing Policy Development Committee by April 18th with a draft resolution, not quite a revolution, to create a Minneapolis Advisory Committee on Housing. The resolution should include the committee's name and purpose, the department or departments that will staff the committee, the number of appointees, the perspectives or organizations each appointee represents, the length of the appointee term, the appointing authority for each appointee, the committee's reporting timelines, how the chairperson and other officers will be selected, attendance requirements, and any other information required by the city clerk. And so that's the staff direction. And in case you're wondering where I got that list, it was from the city clerk. So I'll move to receive and file this and to make that staff direction. Any questions on the motion? Comments? All those in favor, please say aye. Any opposed, please say no. Any abstentions? Well, that motion carries then. And I believe that concludes our business for today. And thank you very much, everybody, for being here. We are adjourned.